Okay, I just wanted to make a quick video because I just had arthroscopic shoulder surgery a week ago, and during my time prior to surgery, I was trying to find videos on this about recovery and things like that, and really didn't find much. So maybe this will help somebody that is gonna go through the same thing as I did. So I'm gonna read my report. Went back yesterday. So I had surgery exactly a week ago. Went back, well, yesterday was a week. Went back yesterday. Everything's fine. Doctor took out the stitches and pretty much sent me on my way, and wants to see me again in 4 weeks. And at that point, he's gonna reevaluate and see if I even need to do PT. He showed me some things I could do on my own. So just go over my report. So I was having severe pain and discomfort at the site of my AC joint, to the point to where I could barely even touch it. I did everything from resting, rehab, cortisone shot, which only helped for about 2 weeks. I had an extended period of time off of not training upper body at all, push or pull, nothing. All I've trained is legs for the last probably 6 months, and didn't get better. So this was kind of a last resort, was surgery. So they scoped it. They classified it as, let's see here. Well, the diagnosis after surgery was bursitis of the left shoulder. So they actually removed my bursa sac, and I actually had, they call it bodybuilder shoulder. That medical term is distal clavicular osteolysis. So basically the end of my collarbone, where it meets your acromion process, the end of my collarbone was basically wearing down, breaking down, trying to repair itself, but it couldn't keep up with the demand and recovery enough to recover fully. So it kind of calcified, I guess, and the doctor said the end of my collarbone was larger than he's seen, and it was actually impeding my shoulder capsule space and causing impingement and discomfort and things like that. So they went in, they cleaned up the edge of the collarbone, took off a little bit of my acromion, and I think that's pretty much all they did. Took off about close to a ½ inch of collarbone. New cartilage, like scar tissue, is going to come in and build over, so it's going to be fine. I'll be back to normal. I'm getting my range of motion back. I'll show you in a minute. But let's see. So they did a left shoulder arthroscopic resection, distal end of clavicle, like I just mentioned, and they kind of debrided the entire shoulder capsule and inside of there, so it just gave it a lot more room to move. Let's see. I had significant fraying of the labrum, so that was one of the concerns, that we might have to put anchors in, but they actually just kind of cleaned up the labrum itself and got rid of the frays that were in there, so they didn't have to reattach or anchor anything, thankfully. Also had fraying of the biceps, so where your biceps anchors is way up in here. The end of my biceps actually had some fraying as well, and luckily they didn't have to cut that and anchor it. So they cleaned up my labrum, and they cleaned up my biceps tendon as well. Let's see. So I also have a lesion in the anterior inferior glenoid with some full thickness cartilage loss. So where your shoulder fits, where your shoulder's in socket, right there in that socket area, some of the cartilage is a little broken down there. They didn't do anything with that, not much they can do. So that is something to keep an eye on. So I'm planning on changing up my entire training regimen moving forward. So let's see. Bursectomy was performed. Like I said, they took out the bursa sac, a new one grows back. They released the CA ligament, so your collarbone has like 3 ligaments on it that hold it in place. they released the one, I don't know the exact name of it, but it's the one there on the end, at the end of the distal end of the clavicle. They released that. That's how much bone they had to like shave away. And then rotator cuff was inspected. There were no tears. I had significant synovitis of the AC joint, so significant inflammation of the AC joint, which is why it caused so much pain and just never healed. Let's see. They then, did a whole full range of motion of the shoulder. There was no impingements. The portals were closed, and that was the end of it. So I'll show you what I'm working with now. So I'll show you the scars, and then I'll show you my range of motion and where I'm at. So you can kind of see I have a scar there, barely, probably there. That one seems to be the worst, but it is what it is. Just scars make you tough. So I'll show you the range of motion. Like I said, I'm only 8 days post-surgery, so currently I can raise my shoulder, my hand to this level, just a little over shoulder level, before it starts to get a little uncomfortable. It doesn't really hurt, it's just tight, a little uncomfortable, and I can go a little bit higher, but not easily. Show you from this way. But I feel like that's pretty good. I'm just basically 8 days out, so I can go out to the side pretty good as well. I can get that about shoulder level. Pretty good. Got decent external rotation at the moment. When like 2 days after surgery, I could barely go to maybe here. So now I'm all the way out to here. The only thing I really have trouble doing is kind of putting on pants or something like that. I can't really get behind me too much here. So that's really the only issue at the moment. But I made this tool today, just out of PVC pipe. It's got a little T on the end of it just to kind of help me get range of motion back in my arm and things like that. So you can see, you can kind of push yourself a little bit further with this. Makes it a little bit easier, just to kind of keep it loose and moving. So I'm just moving as much as I can, really, just to get the stiffness out and the range of motion back, because I'm not doing any PT. So I just kind of found some stuff online, and then the doc's going to reevaluate in 4 weeks, and he might send me to PT at that time, but he doesn't really think I'll need it. Yeah, so maybe I'll make another video here in another week, because that'll be 2 weeks post-surgery, and I expect to be doing pretty well at that point. So maybe I'll give you guys an update and share more with you. If you like this video, like it, comment, share it, and let me know what you think. Thanks.